First aid kit for flu, cold, and COVID-19. 1. Pain relievers. Make sure you have acetaminophen, naproxen, or ibuprofen on hand to assist lower a temperature and relieve painful body pains. If you have hypertension, kidney illness, or diabetes, however, you should avoid taking NSAIDs. Aspirin is also effective, although it should not be given to children. In children, aspirin has been related to Reye syndrome, an uncommon but life-threatening illness. 2. Other meds. Decongestant nose sprays or drops that contain phenylephrine, or pseudoephedrine as an active ingredient reduce nasal edema, and improve breathing. Decongestant bombs applied to the chest can also aid in the opening of airways. Cough drops or medicines containing dextromethorphan relieve a dry cough, while those containing guaifenesin relieve a wet cough. 3. Hand sanitizer. When possible, wash your hands with soap and water to kill germs as effectively as possible. It's also a good idea to keep a hand sanitizer with at least 60% alcohol on hand. When you're sick, keep it by your bedside and use it to mask a cough or blow your nose. Caregivers can also get a squirt after taking a temperature, or feeling a patient's forehead. 4. Tissues. Colds, flu, and COVID-19 can all cause coughs and runny noses. Keep tissues on hand to keep the germs you're sneezing and hacking at bay. Coughs and sneezes should be covered with tissue. Tissues should be discarded quickly, and then your hands should be washed or disinfected. 5. Thermometer. Even if you don't have a fever, it's a good idea to keep track of your temperature when you're sick so you can keep an eye on your body. You'll also need a thermometer in case your temperature rises to the point where you need to see a doctor. 6. Mask. When you have a virus, it's best to stay away from other people. But if you share a house or need to visit the doctor, a mask that covers your nose and mouth is essential for keeping your germs to yourself. 7. Lots to drink. When you're sick, your body loses a lot of fluids due to fever, sweats, a runny nose, and coughing. Water is okay, but don't forget to stock up on other beverages as well. Broth, warm tea, or electrolyte drinks can all help you stay hydrated. 8. Humidifier. A cool mist humidifier releases tiny water droplets into the air to keep your airways moist and relieve stuffiness and dry coughing. Viruses are less likely to survive in humid air than in dry air, so it could also help prevent your illness from spreading. 9. Zinc lozenges. While zinc lozenges do not treat symptoms, studies show that if taken at the earliest sign of cold or flu symptoms, they can shorten the duration of your illness by up to 40%. 10. Pulse oximeter. A pulse oximeter is a little gadget that attaches to your finger and measures the amount of oxygen that reaches your red blood cells. For a cold or the flu, you don't need one. However, if you have COVID-19 and are experiencing symptoms, it may be useful to keep track of your progress. Oxygen levels in the body should be between 95% and 97%. If the readings are lower than that, it's time to see a doctor. 11. When to go to urgent care. It's critical to recognize when home cures are no longer effective. If you or a loved one is having problems breathing, chest pain, confusion, difficulty waking up, seizures, severe muscle pain, a fever over 103 degrees Fahrenheit, or aren't peeing, see a doctor straight once. Thank you for watching, and remember to subscribe and turn on the notification bell.